Hello, everyone, and welcome to the webinar. I'm Andrew Capehart, lead staff person for the Adult Protective Services Technical Assistance Resource Center here at WRMA. I'll be moderating the webinar today. We're going to be hearing from Carl Urban, my coworker here at the APS TARC. He's going to be speaking on the topic of using data to improve APS practice. Next slide. A bit of housekeeping before we get started. Just to let you know, this session is being recorded. It will be posted to the web at a later date, and we'll notify all the attendees, all the folks that registered today via email when it is posted online. You can use your telephone or your computer to connect to audio. Just select the option you prefer under GoToWebinar Control Panel. There's an example displayed here on this slide, and where you can make your selection for that is circled. All participants are muted for this webinar, so there's no need to mute your line automatically, or manual, sorry. Next slide. If you have questions of our presenter, simply type them in the questions box. An example of where to type is posted on this slide and is circled. You don't have to wait until we pause for questions. You can submit yours anytime you like. You can just type them at any time, and I will relay them to our speaker when it's time for questions. So a quick note about our APS Technical Assistance Resource Center. We are here to help APS programs in any way that we can. Just reach out to us if you need help with anything. Contact info for us will be displayed at the end of the webinar when we conclude. You may want to consider joining our APS TARC listserv. There's more information about this listserv attached to the handout section of your GoToWebinar control panel. You can simply download that PDF to learn more. We have more webinars coming in the next several months, so stay tuned to hear about all the topics that we will be covering. Next slide. So I'll take a brief moment to introduce our speaker today. Carl Urban is a senior research manager with Walter R. McDonald & Associates, or WRMA, and works with the Adult Protective Services Technical Assistance Resource Center. Before joining WRMA, Carl had a 25-year career in Texas state government, culminating in services as a director and assistant commissioner in the Adult Protective Services program. Prior to APS, Carl worked on aging and disability issues, including serving as manager of policy analysis and support at the Texas Department of Aging and Disability Services, deputy director of the Texas Department of Aging, and as a member of the Texas Council on Developmental Disabilities, statewide health coordinating council, and the Governor's Advisory Council on Physical Fitness. Carl's experience has also included planning, policy analysis, and consulting positions at the Texas Health and Human Services Commission and the Office of the Governor, and in the private and nonprofit sectors. And without further ado, I will turn things over to Carl.
Good afternoon, everybody. While we're on this slide, I guess I will take a second and talk just a little bit about why working for so long in Texas state government is kind of good preparation for this particular topic. Texas has a legislature that meets every 2 years. And so you may be asking, why is that relevant to data? Well, starting all the way back in the 1970s, the state of Texas was one of the forerunners of really developing and using performance management systems for accountability, for program analysis, for improvement in state government. And so I had that history of kind of working within that system. And then the last agency I was working for was the Department of Family and Protective Services, and we had still have a very robust case management system and data reporting system. And there was a strong management emphasis on the use of data. As a state-run APS program with nearly 1,000 employees and 100,000 cases per year, data really became an essential element of our management processes. So the APS TARC, as Andy was just mentioning, was established by the Administration for Community Living with a mission to enhance the effectiveness of APS programs. Up to now, a lot of our focus has been on ensuring successful rollout of the National Adult Maltreatment Report System and conducting the first ever national APS evaluation, both of which we are using to build the knowledge base about APS so that we can provide high quality technical assistance to APS programs. Today, we are going to focus on a topic consistent with the vision of the APS TARC. How do you use data as a means to improve services to clients? Our goal today is to build the management capacity of APS programs. With the implementation of NAMRS and as a result of recent ACL grants, many APS programs have better access to data than they've ever had before. In our conversations with APS programs over the last year or so about their TA needs, one of the things that we commonly heard was, we need to know better how to use this data that we are now collecting. So this seemed like a good topic for us to cover at our first APS TARC webinar. Today's presentation is going to provide some background on why data is a necessary tool for managing APS programs. Today's presentation is going to present a framework for thinking about how to use data, as well as some thought questions as a result of that framework. As you can see from the topics listed here, we realize that there are some challenges as well as limitations in the use of data. And hopefully this presentation is going to present a clear-eyed, realistic view of both the benefits and the potential pitfalls of using data. Since I'm going to cover a lot of material, please keep in mind several things. One, I'm probably going to go too fast for you to be able to take a lot of notes. So as Andy mentioned, please remember that we are recording this and it will be available online later. We are not going to stop for questions until the end. As Andy said, feel free to type your questions as we go along, but we're not going to stop until the end until we kind of present the whole complete picture. And because of time, there is not really a lot of examples in this presentation. We're going to talk about some APS specific stuff, but there's not as much examples that we could go through. And so at the end of the presentation, we're going to talk about other opportunities to explore this topic in a little more depth. And so with that, let's get started. Before talking about a framework for how to use data, I first want to discuss the nature of data in general and talk about why do we care about it, what is it, how do we use it in social services. Data is a tool of empowerment that can result in better outcomes for APS clients. That's the core assumption undergirding what we are going to be talking about today. Great clinical practice results in great outcomes. But how do you know if your program is using great clinical practice? Data is an important tool for helping you to know that. So this is an example, and it's just one example of many of how the power of information can be used for good. So in 1986, there was federal legislation called the Toxic Release Inventory that required U.S. companies to report all kinds of hazardous air pollutants emitted from their factories. This was data that, under the Freedom of Information Act, became available in July of 1988. And so what happened? Within 2 years, chemical emissions nationwide had decreased by 40%, and for some companies by 90%. So the question is, why had it decreased so much? And that was because of the power of the data. There wasn't any sort of lawsuit, there wasn't any sort of requirements, there weren't any sort of penalties. It was just the power of the information that had become available to folks. So a basic question in human services that we all struggle with is knowing how well we are doing in terms of doing a good job for our clients. And there's different types of evidence or information that you can look at. You can think about it in terms of qualitative information as well as quantitative information. Quantitative, of course, being data. So qualitative evidence tends to be anecdotal and subjective, and it has its place. It has its strengths, but it also has some limitations. And so when you think about those limitations, they include the fact that it has a small sample size, that it is particularly subject to bias. It can either be your individual bias or it can be a systemic bias. And we could talk about this probably for a lot longer. And then the final problem I think that you have with qualitative evidence is that it is often not really focused on what is important. It's not something where you've gone through a rigorous process to decide what's important. It is just what is available. So, given all of these limitations with qualitative evidence, data can help you overcome every one of those limitations. So what do we mean by data? Intuitively, I think we all know what data is. Here is a formal definition I dug up somewhere. So data is information that has been translated into a form that supports efficient movement or processing. But data by itself isn't really helpful to us. It must be organized in a way to help us make decisions. And so we generally call this performance data in state government work or local government work. It's the necessary information to make management decisions about improvements, adjustments, or modifications to your current systems and processes. Finally, it's not just that it's been organized, but it must be used in some kind of framework for improving programs. And so we generally call these performance management systems. They are focused on the ongoing monitoring and reporting of program accomplishments, particularly any progress towards your pre-established goals. It's typically conducted by a program or agency management. And so performance measures may address the type or level of program activities that you're conducting. What's your process, in other words? The direct products and services delivered by the program, we usually call these outputs, and or the results of those products and services, and we call those outcomes. So let's transition from talking about what is data to how to use it. We live in the age of big data, as you all know. It's everywhere. It influences all aspects of our lives for better and for good, for better and for worse. So here's an example. These are two photos I took of back-to-back batters at a Houston Astros game the year before last. So looking at these pictures, can you tell what is different about them? Again, these are back-to-back batters. So the infield is shifted. When you look at the picture on the left, most of the infielders are over on the first base side of the infield. When you look at the picture on the right, all of the infielders are over on the right side of the infield. So why did they do that? They did that because the data said to. It's the basic Moneyball approach of the data detailing the tendencies of individual batters, dictating how the defense sets up against the batter. The Astros were using data to drive much of their decision making, and you'll recall year before last they won the World Series, and last year they lost in the ACL to the Red Sox, another data-driven team. So here's the question I would ask you. Do you think you can use data to detail the tendencies of individual APS caseworkers? Can data tell you the tendencies of your caseworkers? It's really not just sports and culture, though. Data is an increasingly powerful tool in our management world. We hear about business analytics, data analytics, business intelligence tools, and all those things are kind of all of the management rage. Data allows us to know who, what, when, where something is happening almost in real time. And this information can help us make much better management decisions. It doesn't always tell us why something is happening, but it sure helps us to figure out the right questions to ask to help determine why things are happening the way they are happening. It's a very powerful tool, but we all know that tools can be dangerous if they are not used appropriately. A tool can be used to accomplish the wrong things. A tool can cause harm if it's used inappropriately. So if data is this powerful tool, what are the pros and cons of using it? Here are the three overarching themes that I'm going to repeatedly touch on throughout the presentation today. Through years of using data to manage programs, I think I've learned these three things. The first is that data is a means, but not the end, to improving outcomes for clients. The second is that data helps you to ask the right questions, but rarely provides definitive answers on how to improve performance in and of itself. The third aspect of working with data is that the rewards are worth the effort. And it does take some effort, and we'll talk about that a little bit. But you really do have to pay attention to the potential unintended consequences. So let's start with some pros in a general sense. data is a powerful tool to help us define and measure success, to identify what matters, focus on it, and to make the case for the necessary resources to be successful based on it. But the data doesn't necessarily tell us why we are successful. It only helps us to know the answers to the who, what, when, and where questions, and to know what the right why questions are to ask. I would argue it's the proverbial necessary but not sufficient answer to improving program performance. One of the common mistakes in thinking about how to use data is to say, I agree that data is a great tool to use to measure them, but not me. However, all levels in management structure for APS programs, from the worker level all the way through the national reporting level with NAMRS, share a common goal that data can help to achieve, and that's improving casework practice and therefore client outcomes. We can measure performance at each of these levels. Indeed, I would even say, and this may seem counterintuitive to you, that it really becomes a more powerful tool as you move down the levels. In other words, it's a more powerful tool at the worker level than it is at the overall APS system level. So here's the framework for most of the rest of the presentation. Successfully using data is a three-step process. It starts with accountability. When you hold yourself accountable, you can improve your practice by measuring your performance. And then when you measure your performance, which is really focused on practice improvement, you can improve your program overall. And so I'm going to discuss each of these steps in more detail with some examples. So first, let's talk about using data to improve accountability. When we think about using data to improve accountability, there are two things we can measure. We can measure casework practice, and we can measure staff performance. I want to talk a little bit about how we do each of these. How do we use data to measure casework practice? The first thing you have to do is establish program goals or benchmarks in quantitative terms for the critical aspects of your casework practice, as I mentioned a second ago, at each organizational level. We basically have to ask ourselves the following questions. What are the critical aspects of our casework practice? What does our policy framework say that those critical aspects are? What do our supervisors look at when they review a case? Can we think of the answers to those questions in terms that can be defined and measured? If so, then you can establish performance expectations for your practice. So 3 examples are provided here, and there are many others that you could use, but they are validation rate, case duration rate, and recidivism rate. Validation, also called confirmation or substantiation rate, measures perhaps the key decision in an APS case. Case duration helps us to understand several important aspects of practice, not just the efficiency of the casework, but the effectiveness of the casework, if you believe that shorter durations are correlated with better casework. Recidivism, also called revictimization often, helps us understand our effectiveness. Recidivism is also the classic example of the second point made on this slide. A number by itself really doesn't tell us anything. So for example, if you had a recidivism rate of 15%, is that good or is that bad? The answer is it depends. It depends on the nature of your client. It depends on what your recidivism rate was last year. It depends on whether you're trying to change your recidivism rate in a particular direction based on changes in your policy, and so on. The number in and of itself doesn't tell us anything. So the second area that we want to think about is measuring staff performance. Think about the 3 metrics that we mentioned on the previous slide: validation rate, case duration rate, and recidivism rate. What are they measuring? They are actually measuring the performance of individual staff collectively. we can measure how workers are doing in each of these areas. If a worker has performance in one or all of these metrics that are out of alignment with their peers, then as a manager, this is something you need to know. There may be a reason that worker X has a case duration rate that's twice as long as their peers. Perhaps they have financial exploitation or other difficult cases, and therefore their cases take longer. But maybe they don't, and they're just not working as efficiently as they should be. Either way, the data helps you to ask the right questions to understand and improve that particular worker's importance. So, do you believe that you can measure social work practice? Social work practice is inherently case specific, involves very difficult decisions by workers, and really sometimes that is very hard to reduce to metrics. But the power of data is that it eliminates the bias and the difficulty about thinking about performance based on a single bad case or on the subjective qualitative feedback that you may be receiving. Now, the flip side of this is equally problematic. We don't want to reduce staff to data, and we need to always recognize the inherent difficulty of the work. So how do you use data to actually improve worker accountability? I would suggest to you can think about this on two different ends of a spectrum. At one end of it, which I've got labeled here, the minimum end, you can use the data as a resource for conversations between supervisors and employees about employees' development. So if that worker with the long case durations is recognized by the supervisor, they can have a conversation about that employee's practice and what they're doing that maybe that they can focus on to improve. The data tells the supervisor the right conversation to have with their employee to improve their practice. On the other end of the spectrum, I have seen performance data used in staff performance plans, where you can use both qualitative and quantitative metrics to actually measure staff performance as part of their evaluation. We could talk about the pros and cons of that for a long time, but recognize that is a potential use of data to help improve your practice and improve the accountability of the employees that work for you. So as we wind up this section on improving accountability, here are a couple of thought questions for you. The first one is, what aspects of casework practice do you currently measure or do you believe should be measured in your program? The second one is, do you think that employee performance can be quantified? Why or why not? So now let's talk about using data to improve practice specifically. And there are two ways I would suggest to you that we need to think about this. The first is through the process of reporting to internal and external stakeholders. And the second one is this management idea of what gets measured, gets moved, done, managed, changed, rewarded, or improved. You see it formulated different ways in different places. So first, let's talk about reporting to improve practice. And I think this is all probably pretty self-evident to everybody. When you are doing reporting on your data, it does a couple of things for you. The first thing it makes you define what is important. The fact that you chose a metric to put in a report to tell somebody else about what you're doing means, I think this is important. Before you do that, you generally have to think about, okay, this is what we think are important aspects of our casework practice. And so the process of reporting helps you to think about it and to define what you think is important. And then obviously reporting makes you own your performance. In the case of performance management systems like the state of Texas had, we had to tell the legislature how we were doing, and we had to own and explain our performance. So the process of reporting helps you to do that. It helps you to take ownership of what you are doing. So who are your internal and your external stakeholders? I would argue that internal to your program, every APS employee is a key stakeholder that needs access to whatever reporting is going on. That is everybody from the worker on the front line doing the work to the executive that is in charge of your agency. As a tool, reporting really becomes a powerful thing that supervisors and program and agency management can use. Your external stakeholders, I think, are probably pretty self-evident as well. They're your state officials and your community-based organizations, particularly your service providers that you partner with. So now let's talk about this idea of what gets measured, gets moved or managed or changed or rewarded or improved. And you've probably heard some formulation of this in your management career, and it's a fairly ubiquitous and simple idea. The fact that we focus attention on something resulting from measurement of a particular process is going to change behavior in that process. If you focus on it, it will cause a change in the behavior. So you can think about it this way. If you have established that worker X or unit Z or county Y is not consistent with their peers in practice areas such as validation or case duration, and you have a process for measuring it, and then you share that performance information with them and it's readily available, you are likely to see improvement. What gets measured gets improved. Of course, you can think about it the opposite way too. What if you don't measure and communicate performance expectations in any of these areas? Then how are you going to define and expect an improved performance? Your goal is changed behavior, and behavior is not changed absent motivation. And so data provides you with a management tool to motivate changed behavior. So ask yourself, what processes do you want to improve? What behavior do you want to change, and can you measure it? So I can feel coming through this computer how uncomfortable talking about motivation change probably makes you. After all, I'm the one that earlier said that using tools can be dangerous. So I think we really need to beware the potential unintended consequences of using data in this way. And there are a few things to be careful of. First, you can focus too much on one thing. For example, if you focus only on case durations because your caseloads are out of control, you can have staff closing cases without doing thorough and adequate investigations. And I'm sure you can think of many other potential examples of where you can focus on one particular casework practice at the expense of other important ones. The second thing is that you need to always be aware that correlation is not causation. This goes to the theme of data helps us to understand what is happening, but it does not necessarily explain why. Because two things are happening simultaneously, say durations are dropping, but recidivism is increasing, doesn't necessarily mean that faster casework is resulting in shoddy casework resulting in recidivism. The reality is usually more complicated. The data, however, starts you on the path of asking the right questions to understand your reality. Finally, you need to beware of a false corollary of what can't be measured isn't worth managing. And so the best example I can think of for this is how do you measure the culture of your program? The culture of your program is more important than any single metric. And so you need to always be conscious of the culture in your program, even if you can't measure it. You need to manage your culture if you want to improve your performance. Not everything that is important can be measured. So as we wrap up this section on improving practice, here's a couple of thought questions. What's an area of your casework practice in your program that needs improving and could stand a little measurement attention? And then you need to think about what's going to happen, positive or negative, if you start measuring it. The final area we want to talk about is using data to improve APS performance. And this is basically trying to put it all together in a way that you can use from a management perspective. So there are three things I would like us to think about. The first one is how to use data holistically and systemically across your organization. The second one is how to use data to measure the effectiveness of your change efforts. And then the third one is how to use data as part of quality assurance. So this slide lists three tools to help identify areas for improvement and assess what it may be causing poor performance in your program. None of them are particularly easy to do, and they all require some work and some investment of time and money to be made useful. Dashboards are important because they help you see the program holistically. They help you avoid the correlation-causation problem and focusing on the wrong thing. There is usually a relationship across metrics, and by putting them all on one page, it will help you to see the relationship. Benchmarking is important because if you don't have a standard to measure against, then a metric or a particular data number in and of itself is meaningless. Tracking and trending is important because change over time is what matters. It's often hard to know what your benchmark should be, but if you're measuring over time through tracking and trending, then you know what direction your performance is moving in. New business intelligence tools can really help you with tracking and trending. So the second area is using data to help measure the effectiveness of policy and practice changes. So before you make a change, you need to ask yourself, how will I know that this change is successful? What are going to be my indicators of success? And based on these indicators of success, do we collect any data on this? If we don't, can we start collecting data on this? Or should we even collect data on this? So take a simple example. Say your agency passed a rule mandating quicker completion of investigations. How would you assess the impact on your program? You could use the three measures we've previously discussed. The duration measure obviously tells you the direct impact of this particular policy change, but you would not want to only track the duration rate. You'd also be interested in the change and the effect that this change is having on the quality of your casework and on the impact on your clients. So you'd also want to look at substantiation rate and recidivism rate. If you discovered that fewer cases were being substantiated or that your recidivism rate had increased, then you might not judge the new policy as a success. The point is, you need to, before you implement a new policy, think about how you're going to define success, how you're going to measure it, and that way you can assess it once you have had some time for implementation. The third area to think about is as a key aspect of your quality assurance process. If quality assurance is about program improvement, if it's about improving your clinical practice, then you need data to know what areas of your clinical practice need to be improved. QA should be about systemized evaluation of information about what is important in your program. Recall the earlier discussion about qualitative and quantitative information. Both have an important role to play. But when you're assessing the performance of a system, and the provision of APS casework is a system, then you need to start with data. Note that I said start with data. By determining what key metrics are and looking at them through a tool such as tracking and trending or dashboards, you can develop a baseline understanding of what is going on in your program. QA for APS can incorporate quantitative feedback from case reviews as well. Together, all of this data helps you to know the right type of qualitative feedback that you need to gather from workers and managers about how to improve the program. So, in terms of program improvement, here are a couple of thought questions. Which of the following uses of data to improve performance has the most potential for you? Reviewing the program performance holistically and systemically across the organization using the tools we've talked about? Can you use it to measure some policy and practice changes that you are contemplating? And in your quality assurance process, are you currently using data? And for each of these questions, you have to ask yourself why or why not. So let me wrap up and try to hit back on a few of the themes that we've mentioned and try to pull it all together. Up to now, we've not focused much on the process. And emphasis here is on process for collecting and using data. Process is critical if you want to use data to improve your program. But absent quality data and users dedicated to collecting quality data, process is meaningless. As a program, you have to have users that are dedicated to quality data, access to the data, and a system for using the data. If your data quality is poor, then you are not making decisions based on accurate information. If decision makers don't have access to the data, and again, I think everyone is a decision maker, then it doesn't do any good to generate it. If you don't have management processes for using the data, it doesn't really matter who actually has access to it. You need a system in place to think about accountability practice and overall improvement as part of your management processes. Finally, to make these three things happen, then you need to have a program commitment to stewardship of the data. Do you have a commitment? And this is the thought question on process. Do you have a commitment? Do you have someone responsible for the integrity of your data? So, in summary, I hope I've made the case that your use of data is going to help you improve your accountability, your practice, and ultimately the performance of your staff in the way that it impacts the lives of your clients. But I want to be clear that I think there are some limitations in the use of APS data that we need to be thinking about. We need to be realistic about its use. And this slide summarizes some of those pitfalls. In the world of APS, outcomes is a difficult subject. It's really difficult to measure outcomes as it relates to APS clients. Nebulous change attribution means that APS clients, by virtue of the fact that they are older or have a disability, are often going through a lot of change. And whether there is improvement or lack of improvement in a particular client's lives may or may not be a result of APS. The data may help you to understand that, or it may not help you to understand that. Change is just really difficult in terms of attribution in APS. Outcome data is really really expensive to collect in the world of APS. Going back and reassessing clients is something that most APS programs just don't have the resources to do, and so we don't end up on a program by program basis with good outcome data just because of the expense of trying to collect and systemically review the data. It is really critical that data is accurate and reliable. And so you have to ask yourself, how accurate is the documentation of our workers? I think one of the ancillary benefits that we have seen from establishment of NAMRS at the national level is it caused some programs to look at their data and to realize that it wasn't as accurate as perhaps they first thought it would be. Casework is inherently difficult. Documenting casework is not the most important thing that a caseworker does. We all know and understand that, and it should never get in the way of providing good care to our clients. It's a real struggle for programs, and so you have to ask yourself, how do I increase my documentation accuracy in a way that doesn't detract from actual client care? Another thing you always have to be cognizant of is thinking about sample size. If you've only got 20% of your staff reporting on a particular data element, you have to ask yourself, is that data element really telling me anything of meaning, or should I disregard that one as we go forward? And then the final thing is, it's really important that you do not misuse the data. So I have heard staff say the following: all management cares about is the numbers. That's not really a healthy culture in your particular agency about that. And so management always needs to be concerned about that staff are not perceiving that the numbers are more important than what the numbers are measuring, which is the impact on the clinical practice and the outcomes with clients. Therefore, the system that you put in place needs to not be perceived as punitive, but as one that is constructive. That is where that conversation between the supervisor and the worker is the most important conversation, where they talk about how do we take what we are seeing and use it to improve what you are doing. The final thing with data is it's really easy to miss the forest because of the trees. You can get, as the example that we talked about earlier, you could get so focused on case durations that other things are slipping in your program. You want to always be using tools like tracking and trending and benchmarks and dashboards to be thinking about the complete picture and not just isolated parts of the picture that a particular data element could be telling you about. So when it comes to data, you need to accentuate the positive and ameliorate the negative. And remember these three things. It's a means, but not the ends, to improving outcomes for clients. It helps you to ask the right questions, but it rarely provides definitive answers to program questions. And it is worth the effort, but you really do need to pay attention to the potential unintended consequences. So our final thought questions are: what opportunities do you have to use data to improve your APS program? Secondly, do you have the systems in place to make it happen? And those systems and those processes are really important. What are your barriers to increased use of data? And then finally, what are your keys to success going forward? I realize there's probably a lot more we could cover and talk about. And one thing we do want to make y'all aware of is that we have done some state-specific workshops using this material. And if that is something that you might be interested in, please let us know. We can take those thought questions that we've gone and talked about, and we can, with your staff, talk about them in some depth, and we can help you explore how to apply some of these ideas that we've been talking about. I will hasten to add, we don't have unlimited resources or time, so I can't promise that we would always be available for everybody that might request some personalized attention. But we realize this is a really important issue for programs, so we would do our best to help you out. If you have any follow-up questions after we get done today, you can send them to support@APS TARC, and we will get back to you just as soon as we can. And with that, we are ready for questions and answers. Andy.
Thank you, Carl. I think that was very informative. We appreciate that. And now is the time to ask your questions. Just type them in the question box, and we will get to them in order for as long as we have here. We do have a couple questions so far, so I'll go ahead and go through those. The first one is, what data do we currently have in terms of client satisfaction with our social services intervention? Do we have any such data direct from our clients, such as SurveyMonkey or what have you, relative to client satisfaction? Why and why not? So this one relates specifically to client satisfaction. I don't know if there's anything you can speak to with that, Carl.
So I remember getting in an argument with a gentleman one time at a workshop at a conference about client satisfaction when it comes to APS data. I was on the again side and he was on the for side. It seems to me the thing you have to be concerned with client satisfaction in APS is that you are dealing with clients that may not like or appreciate the intervention, and if they lack capacity or if there is some sort of emergency order that goes against their particular wishes, you're going to have probably an unhappy, unsatisfied client, regardless of the outcome from any sort of other objective perspective. That said, there are APS programs that use client satisfaction data. I think there was recently an article published in the Journal of Elder Abuse and Neglect by my friends down at the Team Institute in Houston, where they did some client assessment information and looked at it. And I think Jason, I'm blanking on your last name,
Burnett.
Recently did a webinar. Yeah, thank you. Recently did a webinar for the NAMRS and ACL Research Committee where they talked about how they had used client satisfaction data. I think it's a tool that can be used as long as you are cognizant and aware of the fact that the population has a different perspective and is not always a voluntary population for the services that we are providing. I would be curious to know if there are any state or county-based programs actually out there that have that type of system in place. If you do, you might type that into the chat box or the question box, and Andy will read that off to us in a bit.
Yeah, certainly. And it's an interesting question because at the TARC we had a question recently from another state that was interested in putting this in place. And we do know of at least one program in the U.S. that does this already. So if somebody's interested in that, we could facilitate some peer support and link you with that program so that you can investigate that.
Send us a follow-up email and we will refer you to that state. I had forgotten that.
Again, you can type your questions in the question box, anything that you have, and we will relay them to our speaker. Our next question is, how do you determine the correct sample size? Any guidance on that, Carl?
Yes, you don't have me do it. You hire a statistician, and they can help you. That is my best answer on that. So find your statistician. You have to find somebody in another part of the agency or in another agency that can help you with that. But a statistician can help you with that. I will say a lot of what I have been talking about today in terms of using data does not involve samples. It involves trying to look at the entire data in your particular program, trying to measure all of the performance as captured by your case management system. The one exception to that, and I did not speak about this very long, the one exception to that would be if you have some sort of process of quantifying your case reviews in quality assurance. Obviously, most QA systems, most case review systems are not going to review 100% of cases and are only going to be able to review a sample of cases. I can't tell you what the right sample size is. You got to find somebody that got the PhD in statistics, and that is not me.
We know that a lot of, and this is Andy, a lot of state programs have worked with their local universities to try and sort these sorts of things out. So if you have a university you have a relationship with nearby, they may be very interested in working with you on that sort of thing. Just have to reach out to them and talk to them. And they have statisticians on staff to help you with that sort of thing. So, great. Thank you, Carl. Another question is, how often should a manager look at data?
Every day, a manager should look at data, and I'm being a little facetious there. It depends on what your management process, and it depends on the quality and the availability of the data that you have. My argument that I've tried to make today is it should be incorporated as part of your routine management process. So as whatever your routine management process is, you should involve data as part of that review. Clearly, for something like a dashboard or tracking and trending reports, you're not looking at those every day. Those are going to be produced on a periodic basis for you. whether that be monthly or whether that be quarterly or whether that be on an annual basis. The point is to incorporate it into your management practice on a periodic routine basis as is appropriate for the system that you have in place. For the supervisor, and I think this is the most important discussion that you have in APS, for that supervisor that's having some sort of consultation with their staff on a routine basis about their performance, they should be looking at the data before they have that conversation, whether they're having that conversation once a month or once every 6 months or once a year. They should go into that conversation informed about that particular worker's performance as indicated by the data. And I will say again, the data is not, I think the fancy word is dispositive. It doesn't tell you the final answer to how good a job that worker is doing, but it does help you to figure out the right things to have a conversation about.
Okay. Thanks, Carl. We have some other questions rolling in. Next one is, my APS program is subcontracted by the county to a nonprofit agency. We have limited staff and funds. What are your suggestions on making this manageable to complete with limited means?
So I'm not sure exactly what the question is asking, but let me a couple things come to mind.
Yeah, go ahead, Andy. I was going to say, it sounds like it's more about doing this with limited means. It seems to be the main theme of the question.
Okay, so I will come back to that second. So if you, so the nature of a contractual relationship is something that I did not address in the comments that I provided in this presentation. They were all about systems where you have direct control over the workers or the program. If I had a subcontractor, I think I would have some sort of performance contract that indicated some range of expectations that could be quantified, and I would have some measurement and some process for looking at the measurement of those expectations. Just the process of establishing the performance measures, of having that discussion with that contractor, is going to help them to know what you think is important. If you think it is important that cases are investigated within 60 days, then you have a performance metric as part of your contract that says, on average, we need to be investigating cases within 60 days. That whole process will be fruitful for establishing common understandings and then holding that contractor accountable. In terms of resources, this gets to the point that I was making about using data for reporting. And I didn't emphasize this a lot, but when you're dealing with external stakeholders that have control over your resources that are appropriated to you, then you can use data to make the case for what is going on, whether it is your caseloads or your case durations. And if you can show your trends in performance over time, then data can become a powerful tool to help you make your case for the necessary resources that you need in your program.
Thanks, Carl. It's very helpful. Our next question has to do with repeat cases, if you're able to provide any input. How do you quantify recurring referrals on the same person by many community sources on a competent elder making a poor decision? We receive 6 to 8 referrals sometimes on one person, and there's nothing that we can do about that case.
So this gets to the question of, is recidivism good or bad? And the answer is, it depends on the client. Obviously, I'm not sure data is going to help you solve that problem per se. That's probably a management problem that you're going to have to solve. Otherwise, even if it is solvable, if nothing else, the data is going to help you at least explain what is going on, help you to understand what is going on with certain types of clients. The fact that you have the data to understand this person has been a client 6 times over the last 6 months tells you a vital piece of information that you need to try to use to improve that situation, whether you actually are able to or are not able to.
Yeah. Thanks, Carl. Our next question, can data collected from a grant awarded to APS also help us determine staff performance, not just program performance? How can we connect the two?
Oh, I think that's a longer conversation than I probably can do here. I would need a little bit more information on that. So I'm going to take a pass on that one, just because I don't feel like I really sufficiently understand the question to answer it. Sorry about that.
Yeah, I'm sure a lot of that's okay, and I'm sure that a lot of that depends on the type of data that's collected. So we'll connect you with that person after the webinar. All right, well, we are getting close to the end of our session, so I think we probably need to wrap things up. You can still type your questions in, and we'll relay them to our speaker at another time, and hopefully we might be able to answer them. Thank you, Carl. That was a very comprehensive presentation and probably very insightful for people who haven't worked with data before or thought a whole lot about it. So, as stated earlier, we at the APS ARC, we're here to help you in any way that we can. You can reach out to us anytime at the email address that is listed on your screen. There's also a web address there that you can check out our website, and there's a contact us form on that website that you can type any information in and reach us that way as well. There'll be a brief survey that will pop up on your screen as soon as we're done here, and we'd appreciate it if you could complete that for us. It's only a handful of questions, and it will help feed what we decide to do in the future with our webinars. It'll be very helpful. So thanks to everyone attending today. Carl, thank you so much for the information that you provided. We're grateful everybody could be with us today. Have a great afternoon.